we do have the model now as a prototype. What you can see here is the robotic model built in our hospital. I'm going to just talk about this robot, as well as I will touch on other robots available in the market. Now, why do we need the hub to robot? Why do we think robotic is important? Because it has advantages and it can offer things better than human hands, precision, safety, and also other things like incorporation with artificial intelligence. By means of artificial intelligence, I will show you later on how we can incorporate artificial intelligence in the robot. Now, for remote surgery, we also need something else. So our robot has the advantage over other robots available in the market that it offers remote surgery, which means that the robot will be in one place and the control units and Ingenuity will be in another place. So for that, we need Ingenuity, which is available and we are using it now for the past 5 years. So Ingenuity is integrated in our robotic system. Now, why robotic surgery is challenging in eye surgery compared to other surgeries like general surgery, cardiac surgery, orthopedic, or also prostate surgery? Because of the confined spaces. We have a very small confined spaces, especially if we do vitreoretinal surgery, and that imposes a lot of challenges in the robot to be developed for eye surgery. We also cannot tolerate a lot of latency. We can tolerate some latency, but not a long latency. We also uses multiple instruments while doing surgery. Therefore, we have to be able to use these instruments frequently and interchangeably between hands. And of course, we have to have the feel of a tissue as we are doing, although we are not general surgeon, but sometimes feeling the tissue is an important part of surgery. Now, we are not new in robotics and eye surgery. The pioneer of robotic surgery, a person who I admire, and I think he's a very genius person from Switzerland, Dr. Mark Dismet, who started doing robotic surgery, and the first available robotic surgery is by him a few years ago, and it was certified and used in human eyes for the first time by British surgeon, I think back in 2019, where epimacular membrane was removed by the single-handed robot system that created by Mark D. Smith, which is not available for remote surgery. Another invention of robotic surgery is developed by Horizon Surgical, which is the cataract, AI-driven cataract surgery, which I believe that it is now being tested in United States, and it only performs cataract surgery. Now, for remote surgery, it's something now we need because the technology now is available, which is not available many years ago. Now, the significant improvement in the telecommunication, whether fiber optics or 5G technology, had allowed us to have a high-speed, high-definition telecommunication across the borders of many countries. And this is one of the surgeons from China operated on a patient in Italy with a very minimal latency a few months ago. Now, let's talk about robot. When we started in 2019, initially it was an idea. And the idea is to be able to have a two-handed, two arms, a high-precision robot that should resemble the movement of the human surgeon. And it has gone through a lot of developments, which I really don't want to go, I don't have time to go through detail, but this is during early stages of testing in bionic eye, where we was able to make sure this robot was able to do what I needed to do. Now, this is the final, almost final version of how the robot looks like. And this is some of the photos taking. And as you can see, there is a control unit and there is a robot, which doesn't need to be in the same place. Of course, we can keep them the same place. Can you hear the sound?
دكتور خالد طلع الصوت لو سمحت من عندك بالفيديو بالجهاز. يا شباب الصوت مهم هنا. بس له. الصوت ما كان واضح.
واضح دكتور، للاسف ما كان الصوت واضح. من شريط ابدا
يعني خفيف ولا ما في صوت؟
لا ما كان في صوت. من خيارات المايك تبعك
انا حاط انميوت.
من خيارات المايك تبعك في شريط ابدا في الجهاز تبعك فعل صوت الجهاز نفسه.
Okay. خلينا نجرب الحين. في صوت؟
لا ما في صوت.
نعم.
من قائمة ابدأ يا دكتور.
بسمع.
سيتنج ستارت.
في صوت؟
لا ما في صوت.
audio setting. اوكي ماشي. الحين يشتغل. سامع الصوت؟
Robotic surgery has long been viewed as
الصوت تمام.
في صوت؟
نعم.
the future of medical advancement, and today that future is within reach. Ophthalmic surgery brings its own set of challenges: confined spaces, extreme precision, and a need for absolute steadiness. In 2019, we set out to transform this field, addressing its most complex demands with a bold vision. What began as a concept has become a fully integrated system, a cutting-edge robotic platform built specifically for the intricacies of eye surgery. Not only does it replicate the precision of a surgeon's hand, it enhances what's possible through intelligent features that redefine the surgical experience. So let's explore what makes this system so unique.
دكتور خالد.
At its core, there are presently two robotic arms, each with 7 axes of motion, designed to mirror the fine motor control of a human surgeon. Guided by a haptic controller and foot pedal, the arms respond in real time with intuitive force feedback, giving the surgeon a near tactile sense of the tissue being handled. This ensures delicate maneuvers can be carried out with total control. Surgeons can also invert control settings at any point, allowing them to operate with their dominant hand at all times. Additionally, the tool center point can be adjusted mid-surgery to reduce ocular stress and maintain natural movement. The system also offers ergonomic relief. In longer operations, instruments remain precisely in place even when the surgeon rests their hands, ensuring accuracy without interruption. Clear vision is essential. Our robot includes a network of 3D cameras, each carefully positioned to give full awareness of the surgical field. Every view, whether on the instrument tip or broader operating area, is transmitted with clarity, whether used locally or remotely. A built-in tool exchanger adds further efficiency, enabling the robot to select and switch between preloaded instruments as needed. This feature not only saves time, but also provides the surgeon with enhanced flexibility, ensuring the right tool is always available for the right task. This system has undergone testing for various surgical tasks, such as cataract surgery, vitrectomy, and other delicate procedures. The robot has demonstrated its capabilities, including tremor filtration. In endovascular surgery, for example, it has increased the success rate from 30% to 70%, a task typically very difficult to achieve with the human hand alone. Our system will be fully optimized for remote surgery, leveraging 5G and fiber optic technologies to enable real-time, low-latency control. Imagine a scenario where a patient in an understaffed area requires a specialized procedure. Using this system, an expert surgeon can operate from hundreds of kilometers away with an on-site surgeon present for safety. We've successfully tested this capability with complex tasks, proving that the future of remote surgery is not only possible, but also highly effective. A new software upgrade we are currently working on will also introduce a single haptic control system. One robotic arm becomes the leader, while the other follows intelligently, freeing the surgeon to focus entirely on the main task. For example, if one arm holds a light while the other operates, the system automatically adjusts the light's position, maintaining optimal visibility at all times. In any successful eye surgery, the presence of a skilled assistant, whether a trained nurse or a doctor, is essential for supporting the surgeon throughout the procedure. For this reason, we are now introducing a robotic nurse assistant. This system functions in parallel with the main robotic platform, designed to perform the duties typically handled by a human nurse in the operating room. It can prepare and hand off instruments, load and change tools with precision, manage surgical workflows, and anticipate procedural needs. It is integrated into the control system and follows surgeon commands automatically or upon request, allowing for smoother, faster, and safer operations. What makes this assistant truly transformative is its built-in artificial intelligence. Over time, the robotic nurse learns the surgical protocols and preferences of each individual surgeon. By adapting to their unique working style, it further enhances coordination, reduces response time, and increases the overall safety and efficiency of the procedure. We're also enhancing patient safety. By adding real-time tracking to the patient's head, the robot can adjust if there's slight movement or safely withdraw if motion exceeds safe limits. Possibilities for this technology are endless. In the future, artificial intelligence will further extend this robot's capability, performing repetitive tasks like panretinal photocoagulation or performing segments of surgery. For example, during complex combined procedures, the robot could perform with AI the simpler cataract surgery, while the surgeon focuses on the more specialized retinal surgery. It's often said that if a surgeon masters the skill of eye surgery, they can operate anywhere on the body. And so our robot, with its unmatched precision and capabilities, is poised to support other surgical specialties, making it one of the most adaptable tools in modern medicine. I would like to thank my team and our collaborators for their unwavering support in making this robot a reality.
To summarize, then, robotic surgery, I think it's the future for eye surgery, certainly for retinal surgery. It offers remote surgery. It minimizes the time and cost, and adds safety to the patient and staff. And it will always allow the surgeon to use its maximum skill, and it filters the tremor and makes some of the surgical maneuvers possible, like cannulation of the central veins. So I think this concludes my talk. And once again, thank you very much for giving me the opportunity to be part of the speakers among my colleagues, lead speakers from all over.
We're seeing the future now.
I saw the future of the surgery.
Nowadays, the future in robotics is definitely the way to go.
Always patients are impressed by technology. This is my first time I see a robot ever.
Really, what's sitting there is incredibly impressive, but it's not a big step to realize that we will need in the future. If we don't start to develop now in parallel with the new therapeutics, that we will get to a point where we have a therapeutic without a way of delivering it.
Maybe robotic surgery is a need for only a few situations, a few difficult conditions, but in the future, maybe we perform the genetic therapy.
It's very impressive because it's teleoperated and it's a very complex system, but it's working perfectly and it's very precise. I don't feel any latency while I'm working with it. So it's feel real time and very intuitive.
I was amazed on the delicacy of the movements, how accurate they are, the lack of latency.
It was really nice, extremely accurate, extremely accurate.
I was so surprised about the feedback of the surface touching. Well, that's amazing.
This machine allows us to be even more delicate than we are usually doing. It will be safety and it will reduce the number of complications.
So that will avoid a lot of iatrogenic breaks. So having an instrument that once approaches the retina stops provides you safety.
It's just not only to operate, it's just to train. And this gives you the chance to have a very safe, with a less morbidity, learning curve.
The first application that you see is to be able to visit here and operate in a distance. This brings medicine to new places where the people cannot move and even democratize, the surgery in certain parts of the world.
The future of ophthalmology and surgery especially is robotics in combination with the AI.
Maybe combined with the AI technique, in the future we can do a new surgery what we can't do now.
It's a fantastic machine and can be adapted for each indication. The robotic surgery should be well accepted for different patients.
We're all on the same journey, heading towards better technology to allow us to deliver better treatments for patients in the future.